Welcome, and thank you for joining us in this initiative to raise awareness of the public health and to celebrate healthy populations. This is the first ever European Public Health Week, and the European region of the World Confederation for Physiotherapy is pleased to be involved and to contribute. This is an example of how the EU contributes and works for the European citizens. Taking advantage of the upcoming EU elections in May, the European region of WCPT calls on the European institutions to ensure a 2019 to 2024 strategy to keep the European population active and healthy. The physiotherapists are committed to continuing the collaboration with the EU institutions and to the European population by enabling European citizens to be healthier throughout the lifespan. Physiotherapists recommend that all citizens should undertake daily exercise. Enhancing the health workforce. As essential members of the healthcare team, governments must ensure there are sufficient physiotherapists to meet the needs of the public now and sufficient university places for physiotherapy students to meet workforce planning needs into the future. Reducing patient waiting lists, length of hospital stays and readmission rates. Physiotherapists as first contact practitioners in primary care improve patient outcomes and reduce healthcare costs. We believe that by working together, we can achieve the best outcome for the health of the European citizens. The European region of WCPT represents the national physiotherapy associations of 38 countries in Europe, including all member states. Our proactive commitment is to contribute to EU and European policy aiming for equal access and quality healthcare. Physiotherapy is the health profession with expertise in movement and exercise prescription throughout the lifespan across the health spectrum. Physiotherapy involves specific interventions to individuals and populations where movement and function are or may be threatened by illness, aging, injury, pain, disability, disease, disorder, or environmental factors. Such interventions are designed and prescribed to develop, restore, and maintain optimal health. The European Public Health Association and the European region are working collaboratively on issues of mutual interest and shared understanding for public health and a healthy European population. Based on the latest estimates in EU countries, overweight affects 30 to 70% and obesity affects 10 to 30% of adults. The WHO Commission on Ending Obesity states that the number of overweight or obese infants and young children aged up to 5 years increased globally from 32 million in 1990 to 4 million in 2016. If current trends continue, the number of infants and young children who will be overweight or obese will increase globally to 70 million by 2025. Without intervention, infants and young children who are obese are likely to continue to be obese during childhood and adolescence and into adulthood. Over 60% of children who are overweight before puberty will be overweight in early adulthood. Obesity in children is associated with a wide range of serious health complications and increased risk of premature onset of illnesses, including type 2 diabetes and heart disease, musculoskeletal disorders, mental health issues, underachievement at school, and lower self-esteem. Participation in 150 minutes of moderate to intensive aerobic physical activity each week or equivalent is estimated to reduce the risk of ischemic heart disease by approximately 30%, the risk of diabetes by 27%, and the risk of breast cancer and colon cancer by 21 to 25%. In addition, it has positive effects on mental health by reducing stress, anxiety and depression, and by possibly delaying the effects of Alzheimer's disease and other forms of dementia. In Europe, estimates indicate that over 1/3 of adults are insufficiently active. Men were more active than women, particularly in high-income countries, where nearly 1 in every 2 women did not reach the physical activity target. Through decisions impacting urban design, land use and transport, societies have become increasingly car-friendly over time, and there is a growing geographical separation of living, working, shopping and leisure activities. As a consequence, the role of active types of transport, such as cycling and walking, has decreased dramatically in some countries, as have opportunities for active recreation. Recent research has also suggested that people should reduce extended periods of sedentary behaviour, such as sitting at work or watching TV, since these may constitute an independent risk factor for ill health regardless of other activity levels. The European region has developed an action plan to contribute to the efforts of the European Commission and Member States to prevent and combat overweight and obesity by promoting physical activity in children. The aim is that, led by the Commission and within the EU Platform for Action on Diet, Physical Activity and Health, provide an example of coordinated action on this problem by different parts of society that will encourage national, regional or local initiatives across Europe. Furthermore, it is also aimed to promote and engender the notion of physical activity as an essential part of a healthy lifestyle in children, which can contribute to reducing morbidity and mortality of diseases related to lifestyle in the short and longer term. Informa by disease prevention and health promotion, focusing on the priority group of children and schools, make the healthy option available to schools. The document provides information and resources for physiotherapists and all health professionals, stakeholders, member states, including local authorities, to assist and support them in advocating and influencing the EU, as well as national governments, government departments and local authorities with regard to a physical and healthy lifestyle in children, as well as the recommendations on physical activity and how it affects across the lifespan, starting from childhood. The document also has information on how physiotherapists promote and prescribe physical activity programs in the area of prevention, maintenance, promotion and treatment for children, highlighting programs and campaigns in Europe. Database of national and member states guidelines on physical activity and exercise or health promotion strategies, actions and campaigns for children, including the European region member organisations' actions to promote and disseminate physical activity and exercise benefits for children. EU policy documents, WHO and EU co-funded projects are other relevant projects. We hope this information will lead to the formation of new partnerships to promote physical activity with the different stakeholders of the first European Public Health Week. In conclusion, exercise and movement are the keystone of the scope of physiotherapy practice. Physiotherapists have the specific competencies and expertise that are needed to contribute to increased levels of physical activity and to halting the rise in overweight and obesity among children and young people. The European region would therefore like to present the following plan of action. Physiotherapists should be an integral partner in the development, implementation and follow-up of high-quality physical education programs in schools. And physiotherapists should be an integral part of school healthcare. For further information, please contact the European region of the World Confederation for Physical Therapy.